Did you know that humans have the ability to change the shape of their skull, the curve of the nose, the square jaw, the bags under the eyes, the double chin? These are all physical characteristics influenced greatly by the posture of your tongue. Hello everyone and welcome to Sphinx Sky. Today we will be discussing a technique for facial health and beauty that essentially involves adopting correct oral and lingual posture to breathe through the nose instead of the mouth. This technique has become increasingly popular in recent years, claiming to offer numerous benefits for your face and overall health. Stay with me until the end to discover how to incorporate this concept into your daily routine. Now let me introduce the story of two identical twin brothers. They are called Mueller and Brandon, and they had the same British upbringing. As expected, when they were young, they had practically identical faces. However, somewhere between the ages of 9 and 14, they began to significantly differentiate from each other. Why? Both of them had significant dental problems, but they were treated in completely different ways. Mueller underwent treatment with a conventional orthodontist who removed 2 teeth and applied braces to realign the remaining teeth. On the other hand, Brandon was also treated by an orthodontist, Dr. Mew, but he did not have any teeth removed or wear any appliances. Instead, he performed various exercises to learn how to properly position and strengthen his tongue muscles. The changes became so pronounced with age that it became easy to tell them apart as adults. According to Dr. Mew, poor tongue posture and harmful habits can lead to facial developmental problems such as narrow jaws, misalignment of teeth, and breathing issues. By practicing mewing correctly, he claims that facial growth can be improved and better dental occlusion can be achieved. But does this phenomenon affect everyone? In his book titled The Evolution of the Human Head, anthropologist Daniel Lieberman describes the face as the most complex and modular part of the skull. 4 million years ago, humans had a completely different head shape compared to today. At that time, our ancestors' faces had more similarities with chimpanzees than with us. So how did we end up with our current head shape? There is a relationship between the volume of our brain, the evolution of our hunter-gatherer techniques, and the size of our face. Here are a few examples. When chimpanzees hunt, they have a rather cumbersome method of smashing their prey against a tree to tenderize the meat. It is believed that our ancestors did the same thing for a while until someone invented the very first cooking tool. This preparation made walking and digestion easier, allowing us to gain more calories from food. Another example is that we are one of the few animal species that have learned to share both hunting tips and the fruits of our harvest, which over time has fostered teamwork and improved cooking techniques. And of course, the arrival of fire made all the difference. Over time, we relied less on our jaws, resulting in a reduction in size, while our brains continued to grow. These two factors, combined with many others, have shaped our current head shape, an abnormally large brain sitting atop a relatively flat and long face. However, in recent decades, we have observed a new lengthening of the face, but this time it is happening much faster, and the health consequences are catastrophic. So why is this happening? According to Dr. Mew, it is because we are positioning our tongues incorrectly. Contrary to popular belief, the tongue is not a single muscle, but rather a group of 8 different muscles that provide it with extraordinary strength and flexibility from birth. The first thing that comes to mind when we think about this organ is its role in communication. The word language has the same root for a good reason, but its strength does not come from its ability to form vowels or consonants. If it is powerful, it is because it is the very first tool we use to nourish ourselves, even before we can speak or chew. To give you an example, when a baby is breastfed, the tongue is capable of performing 3 complex movements simultaneously. One part presses the breast against the palate, another creates a vacuum to draw milk, and finally the whole tongue compresses to swallow. These movements are reflexes that we don't even think about, but they actually form an incredible gymnastics, worthy of Alexandra Rose Raisman. And these repeated gestures strengthen the tongue's muscles and teach it to swallow optimally. We swallow between 600 and 1,000 times a day, and each time this movement exerts considerable pressure on the entire palate. To give you an idea, in adults, this force is estimated to be between 400 and 800 grams per square centimeter. So, for an average adult, it's like briefly placing a small dumbbell on their palate every time they swallow. And this force contributes to the growth and widening of the maxillary bone located just above. But even at rest, your tongue should be positioned against the roof of your mouth, just above the teeth, exerting a gentle but constant pressure that opposes gravity. In the modern era, it is observed that a significant portion of the population no longer positions their tongue correctly, and swallowing no longer applies the same force as before. What are the reasons for this? There are several factors involved, but let's discuss 4 of them. Firstly, there are soft foods. The almost complete disappearance of hard foods over 200 years ago triggered an epidemic of orthodontic problems. This leads to muscular weakness that affects the ability to properly position the tongue. The second culprit is mouth breathing. However, several environmental factors such as pollution, dry air, and weather conditions have made nasal breathing difficult. The problem is that as soon as the brain perceives that the airflow is weaker through the nose than through the mouth, it automatically switches to mouth breathing, and the long-term consequences are absolutely disastrous. Thirdly, there is a decrease in the duration of breastfeeding. While we now know that breast milk is ideal for infant nutrition, recent research has also discovered that breastfeeding itself plays an important role and contributes to the development of optimal respiratory and swallowing habits. When you think about it, it's quite logical because bottle feeding engages the tongue in a completely different way. It requires less effort, the flow of milk is much faster, and swallowing is not the same, which overall trains it differently. However, it's important to note that the goal is not at all to make parents feel guilty if they couldn't or won't be able to breastfeed. Unfortunately, there are many individual factors that can make breastfeeding difficult or even impossible. And it's certainly not just a matter of willpower. However, if that's the case for you, it becomes even more important to pay attention to the other points. And lastly, there is a combination of several factors. This is what makes this problem particularly prevalent, because just one of the discussed issues can lead to a cascade of problems, and they will worsen each other. How does it affect our appearance? When the tongue is not in the right place, it flattens everything in its path. Firstly, because it no longer rests on the palate. It will have to find a new place, and in the long term, it often loses its tone and ends up slumping into the lower jaw, resulting in a double chin-like appearance. This new tongue position, combined with mouth breathing, is associated with a gradual retraction of the lower jaw. Mouth breathing is also linked to a reduction in nasal cavities, and the lack of support against the palate leads to orthodontic problems and the progressive sagging of the maxillary bone. This sagging can manifest on the face and contribute to under-eye bags, a more concave curve of the nose, and even less supported cheekbones. Finally, the position of the tongue is directly related to head posture. It is observed that individuals who breathe through their mouths tend to jut their heads forward to facilitate airflow. Of course, these illustrations exaggerate the effect, and everyone is affected differently based on the severity of these symptoms and genetics. But it gives you a rough idea. Now you know how our posture can severely impact our appearance and health. If you haven't done so already, I know that some of you will quickly find yourselves in front of the mirror trying to see where you place your tongues. But I want to reassure you, there is good news. You can reverse some of these harmful effects by consciously correcting the position of your tongue. The practice of training your tongue posture is also known as mewing on the internet. It gets its name from the orthodontist mentioned at the beginning of the video who popularized the technique. He has treated many patients using these techniques, including his son, who has now become an orthodontist himself. And today, he is the one discussing it extensively on the internet. Moreover, there are numerous stories of people who have had impressive transformations after learning to properly position their tongues. But I won't lie to you, the best results are achieved in individuals who still have very malleable bones, namely children and adolescents. When you're older, bone changes are still possible but happen extremely gradually. So forget about your dreams of becoming an overnight Giga Chad. It will require patience and a lot of discipline. However, despite that, I encourage you to position your tongue on your palate as much as possible. Firstly, because it slows down aging, and there are some of you who will appreciate the immediate visual impact of a well-positioned tongue. You may have seen on social media these absolutely impressive transformations of people who completely change with a good position, and honestly, in addition to placing it correctly, they also contract it, which accentuates the effect. But in my opinion, the most important thing is that the more you do it, the more you will breathe through your nose. And that is absolutely crucial for your health. You may say that it's too late or not that important, but believe me, that is far from the truth. However, I want to be transparent and let you know that the subject we discussed in this video is quite controversial among professionals. Firstly, because it involves both health and aesthetics, and these two subjects rarely go hand in hand in everyday life, but also because it is extremely difficult to isolate causes and analyze their impact on such a complex entity like the face. As for me, I have spent a lot of time in scientific literature to ensure that all statements are as coherent and up-to-date as possible. However, compressing them into a short and accessible video is far from easy. So if you're interested in the topic, please like and subscribe to Sphinx Sky and hit the notification bell so you don't miss our future videos.